Bursitis. The best treatment options. Bursitis is the inflammation or irritation of the bursa. The bursa is a sac filled with lubricating fluid, located between tissues such as bone, muscle, tendons, and skin, that decreases rubbing, friction, and irritation. Causes bursitis. Bursitis is most often caused by repetitive, minor impact on the area, or from a sudden, more serious injury. Age also plays a role. As tendons age, they are able to tolerate stress less, are less elastic, and are easier to tear. Overuse or injury to the joint at work or play can also increase a person's risk of bursitis. Examples of high-risk activities include gardening, raking, carpentry, shoveling, painting, scrubbing, tennis, golf, skiing, throwing, and pitching. Incorrect posture at work or home and poor stretching or conditioning before exercise can also lead to bursitis. An abnormal or poorly placed bone or joint, such as length differences in your legs or arthritis in a joint, can put added stress on a bursa sac, causing bursitis. Stress or inflammation from other conditions, such as rheumatoid arthritis, gout, psoriatic arthritis, thyroid disorders, or unusual medication reactions may also increase a person's risk. In addition, an infection can occasionally lead to inflammation of a bursa. Usually gets bursitis. Bursitis is more common in adults, especially in those over 40 years of age. Parts of the body does bursitis affect? Elbow, shoulder, hip, knee, Achilles tendon. Symptoms of bursitis. The most common symptom of bursitis is pain. The pain may build up gradually or be sudden and severe, especially if calcium deposits are present. Severe loss of motion in the shoulder, called adhesive capsulitis or frozen shoulder, can also result from the immobility and pain associated with shoulder bursitis. Prevent bursitis. If you are planning to start exercising, you will be less likely to get bursitis if you gradually build up force and repetitions. Stop what you are doing if unusual pain occurs. Bursitis treated. Bursitis can be treated in a number of ways, including avoiding activities that aggravate the problem, resting the injured area, icing the area the day of the injury, taking over-the-counter anti-inflammatory medicines. If the condition does not improve in a week, see your doctor. Your doctor can also prescribe drugs to reduce the inflammation. Corticosteroids, also known simply as steroids, are often used because they work quickly to decrease the inflammation and pain. Steroids can be injected directly at the site of injury. Injections are often, but not always, effective and can be repeated. However, multiple injections in a several-month period are usually avoided due to potential side effects from the injections and the possibility of masking problems that need to be treated differently. Physical therapy is another treatment option that is often used. This includes range of motion exercises and splinting, thumb, forearm, or bands. Surgery, although rarely needed, may be an option when bursitis does not respond to the other treatment options. Consult your doctor if you have fever, over 102 Fahrenheit, infection is a possibility. Swelling, redness, and warmth. General illness or multiple sites of pain. Inability to move the affected area. These could be signs of another problem that needs more immediate attention. Treating bursitis. Most cases of bursitis can be treated at home with self-care techniques and over-the-counter painkillers. The pain usually improves within a few weeks, but the swelling may take longer to completely disappear. Exactly how long it takes to recover may depend on where the bursitis is and whether it is caused by an infection, septic bursitis. Self-care. There are a number of things you can do yourself to reduce the swelling in the affected joint. Rest the joint until your symptoms improve and avoid strenuous activities that are likely to cause additional pain, such as running. Wearing padding may help protect the joint from further injury. For example, knee pads may help if you have bursitis in your knee joints. Ice packs are also a good way of reducing inflammation and pain. Wrap an ice pack, or a bag of frozen vegetables, in a towel and apply it to the affected area for 10-20 minutes. Repeat this every few hours. While sleeping, avoid lying on the side that has bursitis. If possible, raising the body part above the level of your heart may help reduce the inflammation. For example, you can prop your foot up on a pillow to raise your ankle. If your knees, ankles or hips are affected, try to avoid long periods of standing up. Standing on a soft surface can help, as can placing a pillow between your knees when lying on your side. Being overweight can also cause bursitis, so losing weight may help. Always read the patient information leaflet that comes with the medicine to check that it is suitable for you and that you are taking the correct dose. Aspiration. If the swelling caused by bursitis is particularly severe, you may want to consider having the fluid drained out. This procedure, known as aspiration, can relieve the pain and improve the range of movement in your joint. During aspiration, a needle is used to draw out the fluid before the area is covered with a dressing. You'll need to avoid strenuous activity for about 2 days afterwards. Corticosteroids. If your bursitis symptoms are severe or they do not respond to treatment, corticosteroid injections are another possible treatment option. Corticosteroids contain steroids, a type of hormone, and can be used to reduce inflammation. Your GP can inject corticosteroids directly into the affected area. Possible side effects include the surrounding tissue wasting away and discoloration of the skin around the injection site. You will not be able to have a corticosteroid injection if you have septic bursitis, and cannot have more than 3 corticosteroid injections a year in the same area. Antibiotics. Your GP will prescribe antibiotics if tests confirm that you have septic bursitis. These may include flucloxacillin, erythromycin, clarithromycin. These will usually be taken as tablets or capsules 2 or 4 times a day for 7 days. After 7 days, your GP should check how well you're responding to the antibiotics. If you still have signs of infection, you may need to take antibiotics for another 7 days. If you're prescribed antibiotics, it's important that you finish the entire course, even if your symptoms improve. This will help to prevent the infection returning. Referral. If your symptoms do not improve with treatment after a couple of months, your GP may refer you to a specialist. This may be a rheumatologist, a specialist in conditions that affect the bones, muscles and joints. An orthopedic surgeon, a specialist in the surgical treatment of conditions that affect the bones, muscles and joints. You may also be referred if you have infected bursitis that does not get better or reoccurs. Surgery. In some cases, surgery may be recommended to remove the affected bursa, particularly where septic bursitis does not respond to antibiotics. Surgery either involves removing the bursa completely, or making an incision in your skin and draining the fluid out of the bursa, incision and drainage.